I'm Dr. Despina Afentouli, and this is Modern Odyssey on BronxNet and beyond. Today, we're going to talk about the ongoing COVID-19 global crisis. For this reason, we have a special guest today from Greece. Professor Pavlos Myrianthefs is a Greek from Cyprus and a prominent physician scientist in Greece, where the COVID-19 crisis has been handled well and has turned so far into a Greek success story. Professor Myrianthefs teaches pulmonary, critical care, first aid, and mechanical ventilation at the Department of Nursing of the National Kapodistrian University of Athens, Greece. Professor Myrianthefs is currently the chair and chief of both the Laboratory of Pulmonary and Critical Care and the Pulmonary Outpatient Clinic at the General Oncological Hospital of Kifissia, Agioi Anargyroi, in Athens, Greece. Professor Myrianthefs is also the coordinator of the infection section of the Hellenic Society of Critical Care. He's specialized in infections and intensive care units, sepsis, and immune paralysis. He is the author of numerous medical books, scientific articles, and more than 115 international publications in the medical literature. Amongst others, he is the writer of the Sepsis and Immunoparalysis chapter of the fourth edition of the book, Principles of Critical Care, published in 2015 in the United States from McGraw-Hill. He was invited as a lecture speaker at more than 130 medical symposiums and congresses, and he was a research fellow at the Department of Pulmonary and Critical Care at Feinberg School of Medicine at Northwestern University of Chicago. He has served as a representative of the European Society of Intensive Care Medicine to the European Board of Intensive Care Medicine and is a member of the Competency-Based Forum for the Competency-Based Training Program in Intensive Care Medicine for Europe. Professor Myrianthefs, welcome to our show and thank you for joining us today to our program.
Dear Dr. Afentouli, good afternoon to you and the audience of the BronxNet channel from Athens, Greece. Thank you very much for the kind invitation, the introduction, and your kind words. I'm ready for your questions.
So, Professor Myrianthefs, according to the World Health Organization, coronavirus disease is an infectious disease caused by a newly discovered coronavirus. What are the distinctions between coronavirus and COVID-19, and how does the coronavirus relate to SARS?
So, coronavirus is a family of well-known viruses circulating in the nature and particularly in wild animals. Now we face a novel type of coronavirus named COVID-19, causing the clinical syndrome SARS-CoV-2. The previous one, the SARS-CoV-1, is known as a viral disease recognized at the end of February 2003, caused by another coronavirus. This disease was actually self-limited, although lethal, with a high mortality ratio of approximately 11% because of its low transmissibility. So when a victim was identified, it was isolated and virus transmission was controlled. That's why the disease actually disappeared, and we wish the same will happen with COVID-19 novel virus as well.
We hope that indeed. It has been recently reported that COVID-19 is mutating. What does this practically mean?
Yes, that is an interesting question. Mutation means that the virus is changing phase and tools in order to fight or better resist to human defense mechanisms. That is to facilitate its entrance into the host cells and to invade into the human cells and then multiply. This is actually a fast mechanism of virus adaptation to the environment in order to survive and to, of course, to predominate.
So what are symptoms and how does a person know if they're infected from COVID-19?
Well, common symptoms include the symptoms of a common viral disease like flu, that is fever, chills, repeated shivering, shaking with chills, dry cough, sore throat, fatigue, headache, muscle pain, thoracic tightness also, conjunctivitis, that is sore, itchy, or red or pink eyes, also a rash on skin or discoloration of the fingers and toes, loss of speech or movement. However, there are some additional symptoms, including gastrointestinal symptoms, ranging from loss of smell, loss of taste, to abdominal pain and diarrhea.
According to official sources, coronavirus affects vulnerable groups, such as people with medical issues and older people. However, in the meantime, it has been noticed that even children and younger people with no recorded health issues get infected seriously. What has the medical community learned so far through the coronavirus pandemic in relation to the vulnerability of the people?
So this is a very, really interesting question. We know very well that vulnerable people are patients with pre-existing diseases, including mainly hypertension and cardiac diseases, diabetes mellitus, and especially those with type 1, that is insulin-dependent diabetes mellitus, immune deficiencies, immunosuppression, current cancer, etc. Most people having this problem are old, and that's why older people are vulnerable. So people aged 65 or more, and especially when they have underlying diseases are the most vulnerable. However, even children, young people, or middle-aged people may be vulnerable due to their differing immune system behavior. That is, their immune response to the coronavirus acts catastrophically to the body and tissues, resulting in tissue damage, organ failure, and then finally death. This may occur even in young people or children, and that's why we observe mortality in very young age. We had several cases worldwide, but also in Greece, regarding young people with serious infection and even mortality. To conclude, I need to say that we know little things about the coronavirus and the human immune response yet, but we are learning every day more and more so that we can understand it and face it much better.
Well, another important aspect to consider are the symptoms. So when do symptoms start showing if a person is exposed to the virus?
So commonly, symptoms start within a week. The median day is the 5th day after exposure or inoculation. But the window extends up to 14 days or even more. Also, it is important to say at this point that many people may not develop any symptoms. These are the asymptomatic carriers, or people may develop mild symptoms. It is worth mentioning that asymptomatic carriers are a significant source of infection spreads, and the reasoning behind lockdown and physical distancing.
And when should a person infected with the COVID-19 virus ask for medical care?
This is a very crucial question because any delay may be catastrophic and lethal. As soon as the people develop high fever, more than 38.5 degrees centigrade or 101.3 Fahrenheit, persisting for a couple of days, or the development of dyspnea or thoracic pain, or thoracic discomfort, or dry cough, especially if combined with hemoptysis, or the people develop confusion, difficulty to wake up, that is lethargy, or bluish lips or face, known as cyanosis, the patient should take promptly a medical advice. Here in Greece, it was also suggested by physicians for people to monitor oxygen saturation using oximeters, which are small finger-fit devices. So if the oxygen saturation in a previously healthy person fell below 94%, it was suggested to take a medical advice. This suggestion was helpful because a lot of people having pneumonia and low saturation did not develop clinical dyspnea or any chest discomfort.
So, Professor Myrianthefs, there are questions asked about mechanical ventilation. What are your thoughts about that?
Very, very interesting question. Thank you very much. Actually, mechanical ventilation is an invasive procedure. When a patient develops respiratory failure and requires high concentration of oxygen, we need to intubate him in order to give him 100% of oxygen. However, mechanical ventilation is not the normal way of breathing. We normally breathe producing negative pressure to the pleura. On the other hand, mechanical ventilation is a positive pressure to the lungs, which may harm the lungs. Actually, I had my PhD 20 years ago, finding that even in normal lungs, when you ventilate them with mechanical ventilation, with artificial ventilation, you may produce harm to the lungs. So we may be very careful when ventilating patients with lung injury, and especially with COVID-19, because there are a lot of data, especially from Italy and the United States, suggesting that mechanical ventilation to the lungs may be harmful. You need to behave very gently to the lungs. You need to have low pressures. So if you develop high pressures to the lungs, you may harm them, which means that we need to monitor when using mechanical ventilation and measure the pressures developed within the lungs. However, mechanical ventilation is the only way to support the failing ventilation of the patient and give him adequate oxygen in order to survive.
So regarding coronavirus testing, I'd like to ask you to please tell us about COVID-19 laboratory tests.
Well, actually, we have two different types of tests. The molecular test, which is a PCR test, identifying the virus itself, and is the best method currently to diagnose the disease. On the other hand, we have the antibody testing, and there are around 42 different tests developed. These tests are fast and identify the human response to the virus, measuring IgG and IgM antibodies produced by the immune cells. However, they became positive only after 10 days, and thus they are not very useful for the diagnosis of the disease in the acute phase. Also, they have significant percentage of false negative results, that is, losing infected people. They are useful basically for epidemiological reasons after the pandemic crisis recession.
And what are the complications that may occur to a person with the COVID-19 virus?
So, well, serious acute complications include viremic shock, that is low blood pressure, pneumonia and respiratory failure, acute respiratory distress syndrome, also known as ARDS, disseminated intravascular coagulation, known also as DIC, vein thrombosis leading to fatal pulmonary embolism, and multi-organ failure leading to death.
And how does the coronavirus affect a person with COVID-19 in short term and long term?
This is actually called the natural history of the disease. Normally, the patient will recover within 2 or 3 weeks after symptom appearance at home with minimal support or just painkillers or fever reducers. However, if the patient worsens, this will occur around 6 to 10 days after symptoms initiation. Again, the patient may recover within 3 to 4 weeks after hospital admission, having support by a cocktail of drugs, not well defined yet, and without any known definite therapy. On the other hand, patient may further worsen, require oxygen therapy or mechanical ventilation and ICU care. Again, some of them will survive this ICU adventure. Here in Greece, ICU survivors are around 1/3 patients, that is around 33%, which is quite high percentage compared to other parts of the world. This is probably because the pressure on the health system was not that high, and completeness of ICU beds was much low, below 50%. ICU survivor may then develop chronic fatigue syndrome, stiffness, and kinetic problems, also declined pulmonary function in case of pneumonia. But actually, we have a lot of things to learn yet regarding the chronic consequences of COVID-19.
How close are we toward finding a cure for COVID-19 or a vaccine?
Well, I actually do not know exactly, but as far as I know, a large amount of pharmaceutical companies are working on that. And according to their reports, we are coming to the targets. At this moment, I want to emphasize that in medicine, we need both the vaccine to create immunity for responsive people and the drug for people who vaccine administration will not be able to produce adequate amount of antibodies. However, even having both, mortality will not be zero, just like what happened with the flu case. Until now, we do not have definite treatment, and results from clinical trials show that chloroquine, hydroxychloroquine alone or with a macrolide may be related even to worse survival due to cardiac arrhythmias. Several other combinations of drugs have been used with conflicting results. The only useful drug identified until now was remdesivir by shortening the duration and the time to recovery by 4 to 5 days, however, in not intubated patients, but not affecting mortality of these patients.
And Professor Myrianthefs, I'd like to ask you if there is a stigma around coronavirus disease and if you have any advice on how to handle it.
Yes, dear Despina, this is a socially and ethically pivotal question. People infected with coronavirus need not to feel as a stigmatized person, but as a person that may be part of the solution against SARS-CoV-2. That is, their health adventure may help scientists either to solve the current mysteries of the novel virus or to help other seriously infected people to recover by giving their antibodies using the convalescent plasma methods. This behavior not only destigmatize infected people, but on the other hand, make them useful, proud, and heroes in the fight against the disease. Also, an advantage of these people is that they do not need to take the vaccine when developed because they will have natural immunity. Of course, there is a problem with when facing a person currently or previously infected, taking physical distance and wearing a mask or gloves make them feel unwanted. However, we need to explain them that there is nothing personal but just prevention and not fear or an offending intention.
Professor Myrianthefs, what are the best precaution measures against COVID-19?
Yes, this is actually a very, very useful question. We have two arms of effective precaution measures: infection prevention measures and infection control measures, which include the following. The basic measure is not to touch our face, our mouth, or our eyes without washing our hands as a part of personal hygiene strategy. Hand washing may be done using soap and water for at least 20 seconds. If we do not have soap, an alcohol-based solution is suitable. Second basic measure is physical distance of at least 1.5 to 2 meters, that is 4 to 6 feet far away. Third measure is to avoid coughing and sneezing, among others. Avoid social gathering without any significant reason. Fourth measure is the disinfection of surfaces to remove viruses. And finally, the use of a face mask is currently used in several crowded places, such as the metro, buses, squares, etc. I would like to emphasize on that there must be no fear and no panic behavior. There is just a need for correct information and responsible behavior for disease prevention and to avoid isolation or incarceration. Of course, another measure may be the boosting of our immune system using micronutrients like vitamin C and vitamin D, micro minerals like magnesium, trace minerals like selenium, which may play an important role for defending against COVID-19 through a balanced nutrition, which should be rich in vegetables and fruits, avoiding much animal protein and trans fat, and certainly having physical activity, and finally, a positive psychology.
What sources should people rely on to get correct information about COVID-19?
There is a need for official information. So what happened in Greece was very important. So every afternoon was on TV, listening to official information by the Ministry of Health and the head of the campaign, informing what is happening in Greece and all over the world. So they knew how to behave, to stay home or go out, to how to wash hands and everything.
Please share your personal evaluation of the coronavirus pandemic or lessons learned so far.
Very simply and concisely. First, the development of personal responsibility regarding not only self-protection measures, but also other fellow men. Second, changing or adapt of our behavior, mentality, and attitudes on everyday life in appliance with health hygiene measures in such an emergency condition. Third, prioritizing health and life over economic harm. And finally, fourth, the creation of a safety culture in everyday life. Here I can present that the Greek story is based on the following chain. At first, the pandemic crisis affected Italy, which is next to Greece, and thus Greek people were familiar to North Italy disaster. Secondly, based on Italian experience, the Greek government took immediate, correct, and timely applied prevention measures, including school closing, lockdown, and distancing. A key point is that the chief of the campaign was heard by the prime minister of the country, and he was actually every afternoon at 6 o'clock for an hour or so on TV in every house, informing and advising people. Finally, and most importantly, the Greek people cooperated with the government and tightly kept the measure. So most people stayed at home for approximately 2 months. I emphasize the issue that both the government and the people understood that health system in Greece, but also everywhere, would not be able to cope with the pandemic. Greece had only around 600 ICU beds, and now we doubled them. So the Greek success story is a chain of things. First, correct measures, timely applied measures, and keeping measures by the people for almost 12 weeks in order to buy valuable time. Actually, the problem is that we were unprepared. The world was unprepared. So when I say that the people in Greece stayed at home to buy valuable time, this is the key. Buy time in order to get prepared.
How do you think that people should be prepared for now as infection rates dip and as there is some economic reopening?
I think that people are completely informed, educated, and developed responsibility to protect themselves, at least in Greece, as far as I know. However, the disease is not completely controlled, and we will have more and more focus of disease activity everywhere. Also, health systems are equipped and hired doctors, nurses, etc., and are better prepared. On the other hand, we need to resocialize again and to restart economic activity because life is going on, and we need to produce wealth. So we need to find a balance, actually the fine-tuning between social and economic activities on the one hand and unacceptable, let's say, morbidity and mortality on the other hand, based on what the health system of an individual country can afford. This is actually what is happening regarding other diseases like flu, for which we have 100 or 150 deaths every year in Greece and 37,000 deaths in the United States this year. Of course, it will be much better if we find a vaccine and an effective drug soon. I would like to emphasize also that Greece is updating its protocols regarding COVID-19 prevention and control, especially in view of the tourism reopening this July, without any fear, but with confidence to prevent or manage any reactivation.
Is there going to be a second wave?
When speaking about a second phase or a second hit, we know that we didn't control the disease. We know that we don't have drugs. We know that we don't have a vaccine. We know there are still foci of disease. So possibly there will be a second hit, which will possibly be in October. So we need to be prepared, because we will not, the governments all over the world will not take any lockdown measure again, I think. So in view of a second hit, we just need to be prepared and take precaution measures.
As you said, the key was to buy time.
Yes, it was a key. It was a key component. Buy time, because we were unprepared. We were unprepared and we were unable to prepare it. We were unable to buy. I estimated that we may need in Greece 2,000 additional ventilators. We couldn't find 2,000 additional ventilators. We couldn't buy. Nobody gives you in such an emergency. Nobody sells you. Nobody sells you 2,000 ventilators to have. However, in Greece, we have a couple of companies that produced masks. So they bought machines from China, and they were able a month ago. So Greece is now ready and is producing 9 million of face masks on a monthly basis, which is enough for the requirements of Greece. But it's not easy to produce ventilators or other things.
Professor Myrianthefs, would you like to tell us a few words about your current research?
Well, thank you very much for this question. One of my research and interest is sepsis-induced immunoparalysis, which is how the immune system is suppressed and dysregulated due to severe infections and sepsis, leading to secondary infections in the ICU and late mortality. Well, also as a coordinator of the section of infection of the Hellenic Society of Critical Care Medicine, my research priority is the investigation of antibiotic resistance in the ICU, that is the MDR and the PDR pathogens, the so-called carbapenem-resistant gram-negative pathogens. In addition, my thoughts are to apply an ICU antibiotic stewardship program based on artificial intelligence and telemedicine. Finally, this winter, we planned and recorded H1N1 infection course among 35 ICUs across Greece, and we now analyze this data.
For this crisis, what does unite us?
Well, coming to the end of this discussion, I would like to say that this pandemic may be an opportunity for our world and for all of us to express our solidarity, our empathy, our cooperation, and stand out of the value of human life over profit, and to develop, of course, a safety culture.
So, Professor Myrianthefs, thank you so much for sharing with us all this vital information that can apply to everyone, no matter where we are in the world right now.
Dear Despina, thank you very much indeed for the invitation and having this very interesting discussion. So I would like to say goodbye. Γεια σας και ευχαριστώ πολύ.
Thank you so much again, Professor Myrianthefs. Well, this was Professor Pavlos Myrianthefs, and this was Dr. Despina Afentouli. Thank you so much for watching Modern Odyssey on BronxNet and beyond. Until next time, we hope you stay safe and healthy. Γεια σας.